Welcome. My name is Melissa Rao, and I'll be talking to you today about what is involved with being a pharmacy technician. A little about myself. In 2003, I became a pharmacy technician. I now have been working in the pharmacy department at a local DFW hospital for over the past decade. This is a great career to have and has been rewarding in my professional development. As a pharmacy technician, you will be working in a professional environment that requires strict attention to detail. Anybody who is thinking about this career needs to understand that it is a vital aspect to be very correct when you're dispensing medications, because some of these medications are very harmful otherwise. It is a rewarding field to be in if you have the discipline and the desire to pursue it. Okay, now let's get to know a little bit about each other. I would like us to go around the room and tell everyone your name, your favorite color, and the reason why you would want to become a pharmacy technician. LaShonda, let's start off with you today.
Hi, my name is LaShonda Matthews. My favorite color is blue, and I thought being a pharmacy technician would be a good career change.
My name is Trinity Matthews. My favorite color is blue, and I want to be a pharmacy technician so I can earn money for college.
That's an excellent, good job going to college.
Hi, I'm Camilla Rao. My favorite color is blue, and I find myself going back out into the job market at a later age in life. So I thought that this might be a really good avenue for me to become a pharmacy technician. I'd like to work maybe in a hospital setting.
My name is Rajiv. My favorite color is green. Just switching up fields, trying something new is why I'm possibly thinking about becoming a pharmacy tech.
That's good. Those are all good reasons. Again, welcome and glad to have you here today. All right, now let's do a little role play activity. LaShonda, I think you volunteered earlier.
Yes.
I'll have you come up to the front, and if you'll pretend that you're a pharmacist, and then I'll pretend that I'm a pharmacy technician, and we'll show how to inappropriately interact with pharmacists, and then we'll show an example of appropriately interacting with the pharmacist. And we'll just stand over that. Hi, pharmacist LaShonda. Can you just please check this for me so I can take it up to the front nurse's desk? They're complaining about getting the medication. That's the incorrect way to talk to a pharmacist. All right. Rajiv, I'll use you as an example for the correct way to talk to a pharmacist.
Okay.
Let's stand up. Pharmacist Rajiv, could you please check this for me so that I could dispense it to the nurse's station? I would much appreciate it.
Yes, well.
That is the correct way to interact with the pharmacist. You want to be very professional and polite and just show some respect. All right. Being a pharmacy technician. We've got several things that we're going to cover in today's presentation. Let's go over the history of the field of pharmacy. Some of the history is the armed forces introduced formal training for pharmacy technicians in the 1940s. Due to changes in the medical field, they found a need to have assistance for the pharmacists. In the 1950s, the American Society of Hospital Pharmacists began to push for pharmacist assistance. During the late 1980s, the pharmacy technician took hold and became an official job position. LaShonda, what do you think is a pharmacy technician?
A pharmacy technician is someone, a person who assists the pharmacist.
Good answer. They do assist the pharmacist. They compound IV drips. They pull and dispense medications for each patient and the nursing floors. They interact with doctors and nurses and other medical staff members throughout the facility. And they play a vital role in ensuring that the pharmacy department runs efficiently. When, like we did with in our skit, you will be interacting with the pharmacist. There's positive and negative interactions for interacting with pharmacists. From the examples that we showed, why do y'all think it's a good way, appropriate way to act with a pharmacist? Does it promote professional behavior, or?
It's more professional, it's more clear and precise.
That's good. Good answers.
You have to have respect, you gotta act them all day long. You're constantly getting things checked,
Yeah, you want to create a positive relationship and,
positive relationship.
and make sure that everything runs as smoothly as possible, because you are in a more professional environment as a pharmacy technician. Okay. LaShonda, what's required of a pharmacy technician?
Working with equipment and you dispensing medications, you're compounding IVs. You got to know the sterile techniques. You have to clean the hood daily or in between shifts and in between compounding
Yep.
certain products.
That is correct. There are a wide variety of things. You have to know how to interact with pharmacists, know your sterile techniques. You have to, in some facilities, you'll utilize what we call the Imprint pre-packing program. And you'll utilize the Care Connect system for looking up patient information. And you'll have to work with equipment such as the Pharmagistics Inventory Management Carousel. And you'll have to operate the Pharmacy Consult system and the Pyxis Connect machine up on the nurse's floor. Okay, this is the Pharmagistics Carousel. This is usually found in the main pharmacy. It basically manages your medication inventory and allows you to pull medications for the nursing floors and for individual patients. You're working with computers, and then you have your scanners where you scan the barcode of the medication and then scan the barcode of the label for the patient. And this allows us to safely and accurately dispense medications to the patients and let the pharmacist double check our work. Okay, this is another system that you might be using as a pharmacy technician. It's the Imprint pre-packing program. This machine allows the pharmacy technician to pre-pack bulk medications into individual packages so it can be dispensed accordingly. It's pretty simple to use once you get your hands-on skills. It's like riding a bike. Okay, this is for a pharmacy consult system. It's usually found in the main pharmacy. This basically shows a list of every medication that's in the entire hospital in each Pyxis machine on the nurse's station. You can scroll through this and find what medication is in what area and how many they have, so that you can better assist the nursing units and get them filled. Okay, this is the Pyxis Connect MedStation 4000 machine that is found on every nursing station in the hospital facilities. They're located behind locked doors on each nurse's station, and they contain a variety of different medications, and it's an inventory management machine for each nursing unit. This allows the nurses to take out any type of medication that they need and have it tracked. Okay, inside the pharmacy department, you're going to find the laminar flow hood room. This is where we compound IVs and make drips. It's a very sterile environment, very sterile room. You have to clean it daily, mop it down, make sure there's no trash, no possible bacteria that could be contaminating these flow hood rooms. Alright. Now we have, as a pharmacy technician, you have to deal with sterility standards and specifications. LaShonda, what are ways that we can prevent bacteria growth?
By cleaning the hood, wiping it
what are ways that you think that we might be able to prevent the spread of bacteria?
Well, whenever you make IV compounds in the hood, you must, make them beyond 6 inches from the front of the hood.
Reggie, what do you think are ways that we can prevent the spread of bacteria?
Just following your protocol in regards to properly cleaning it, your utensils after every time you use them.
Those are some very good answers. Thank you. Definitely want to make sure we clean everything properly and make sure you use the proper alcohol and mandated alcohol wipes to clean both the floors and the hood room. This prevents any spread of bacteria and prevents our patients from becoming sicker than they already were when they entered the hospital. Also, when you're in the hood room, when you make IV compounds, you've got to make sure that you're garbed up correctly. You want to make sure you have wear your hat, your shoes, your mask, and make sure your hands are washed appropriately and you have your gown on. This again prevents any contamination and prevents the spread of bacteria. And as a pharmacy technician, you have to perform an annual sterile technique. It varies from different facilities, but the facility that I work at, you basically have to have 2 vials. That's what the red vials are. You'll make a couple of drips, and you'll put your fingers to those vials, and then you'll make a couple more drips, and then you'll put your other fingers to the second vial, and then they'll take that off to the lab and they'll test it for any bacteria growth and see if you're performing a sterile technique properly. Whenever you do make IVs and compounds in the pharmacy, you have to document them appropriately, especially when making chemotherapy, because it's a very hazardous drug material and it could be harmful to you and to people who have to touch it. Okay. LaShonda, how do you get certified as a pharmacy technician?
You have to go to ptcb.org and apply for an exam, and then you take your exam and you pass, you come on pharmacy technician.
That's a very good answer. Whenever y'all do go sign up for your to take your pharmacy technician exam, you go to ptcb.org, you'll go under exam, you'll apply for it, and once you register for the test, you'll go take it at the facility that they've recommended for you. Once you pass your test, you're now a certified pharmacy technician, and then you can register with the state of Texas. That'll be additional fees, but you can go through the Texas Department of State of Health, register with them, and now you're covered on both, being a pharmacy technician and registered with the state. You have to be at least 18 years of age and have a high school diploma. And Trinity, you met the requirement. Congratulations, you just had a birthday. Happy belated birthday. But it's pretty simple and easy to do. And then once you get all your credentials and your license, then you can go apply to either a hospital or a retail facility, and hopefully they will hire you on as a pharmacy technician and start your new career. All right. In conclusion, today we have discussed the professional way to interact with the pharmacist, what the Pharmagistics Inventory Management Carousel is, how to operate the pharmacy console system in the Pyxis 4000 machine, also what the Imprint prepacking program does, and know what the sterile techniques are required from the pharmacy staff, and how to obtain your pharmacy technician certification and registration from the state of Texas. Does anybody have any questions about the information covered in today's presentation?
I don't think I'm good.
Good. Anything else? Okay. All right. Well, thank you for coming today. I appreciate you. There's some refreshments in the back of the room. Feel free to grab some on the way. And there's some evaluation form also in the back. have any suggestions and see how you like this presentation, just write them down, and y'all are free to go, okay?
Thank you.
No problem.